PTSD episodes through a host of different times. During pregnancy, the day of delivery, the postpartum period, typically what we think about is up to 6 weeks when you come back in for your final visit. And typically, we've said that that's the end of it. But to everyone who's had a new child in their home, you know, really that's when the fun part begins, right? That's when the stress, the novelty for everyone else is gone, and you're there, and life is different. And what we see are that about a third of pregnancy-related deaths can actually occur outside of that window from 42 days to 365 days. So it's across that continuum when we can have these outcomes. So when we look at the causes, the top number you see, these are the pregnancy-related deaths from 2018 to 22. And as you can see, infection is number one out of this list. And I think we all remember when the world got sick, and that sort of changed the skew of that. But you can see right up under that, what do you see? Cardiomyopathy, cardiovascular conditions, hypertensive disorders of pregnancy. And those have traditionally been 1, 2, 3 as we looked at it. And so that leads us to our talk now. So pregnancy is a window. You can think of pregnancy as a window into your future health. And the things that your body may encounter during a pregnancy may be harbingers of things that you're going to encounter later. Many of the risks that begin during pregnancy, the hypertension, diabetes, if you begin to see those things, then in fact, if you get them through that window of pregnancy, it doesn't mean they're necessarily gone. They may be back in the closet somewhere. They're going to show up later, okay? And so the opportunity during that pregnancy is an opportunity for early intervention. And if you look at, I would encourage everyone to take a look at what ACI has done through their pregnancy journey. There's a phenomenal amount of information about this. And one of the things they can see is that for every 100 new Arkansas moms in 2021, 84 began prenatal care in the first trimester. Okay? And you can see, so that's saying 84 out of 100 began prenatal care in the first trimester. But if you can see it, if you're looking at the best states in terms of that number is 93%. And so we are lagging behind. And those lost opportunities for intervention can have consequences down the line. When we see trends in cardiovascular disease, Dr. Fletcher mentioned acquired cardiovascular disease. We mentioned congenital cardiovascular disease. But when we're talking about cardiovascular disease, it affects about 1 to 4% of pregnancies in the United States. And the most common presentation that we see are heart failure. We may see a myocardial infarction. We may see an arrhythmia. Or in fact, we may see an aortic dissection. And each of these could be devastating. And if you go back to that conversation that I had about mortality, if you say someone went through any of those and they went through morbidity, that's a lot, but it's not necessarily captured in the mortality numbers. So pregnancy is a stress test. And when someone is going through a pregnancy, a number of changes are going to go on. The blood volume is going to nearly double. The cardiac output, the work of the heart, is going to go up significantly. The mass of the heart is going to compensate for this. And if someone is not healthy going into it, those added stressors are not necessarily a good thing. You're going to have the hemodynamic changes, the structural changes. There are increased risk of developing thrombosis and developing clots just as a result of being pregnant. And so when you couple each of these things, they can have an outlying and sort of compounding effect that raise the risk of cardiovascular disease. The consequences of cardiovascular disease. So the risk factors that we see, hypertension, this can occur across the maternity care period. Gestational diabetes. Gestational diabetes quite often is transient. There's some insulin resistance that a person may encounter during their pregnancy, but it may go away. And so they've had diabetes during pregnancy, but may not necessarily be diabetic after pregnancy. But it certainly has a possibility of showing up. And when someone's experiencing those metabolic changes, those are the harbingers of things to come. Obesity, lifestyle factors. Lifestyle factors is a very broad term. And so to what Dr. Bala has been discussing in some of the programs that we're doing in terms of training folks, lifestyle medicine is a very important thing in terms of improving health outcomes. Postpartum complications, race, ethnicity, social determinants, and age. I'll touch a little bit about each one of these, but I will say as we have seen the practices of when people start families change a little bit, what we are seeing is that we may see more cardiovascular disease than we have in the past. When we look at our mortality data, the moms who are advanced maternal age, the number of moms who are over 35 who are having babies, then their mortality goes up significantly. And in fact, that's one of the highest risk groups. So hypertensive disorders, what we're talking about is people can have chronic hypertension in pregnancy, but we don't know it if you don't come in early for us to identify it before 20 weeks. Preeclampsia is a condition that's unique to pregnancy, typically resolves after pregnancy, but those changes can be indicators of hypertension that may persist or cardiovascular disease to come. It affects about 10% of pregnancies, and it certainly is an indicator of potential future heart disease risk. Gestational diabetes, and we can talk about people who are diabetic prior to pregnancy, type 1, they're going to have a host of metabolic changes that raise the risk of complications, and as well as people who have type 2 diabetes as well. With our gestational diabetes patients, typically they may be diabetics who are managed with diet alone. In fact, they may require insulin, and so they can have basically increased risk of complications down the line. Each of these are increased risk factors. Obesity and lifestyle. The goal is to come into pregnancy as healthy as possible. Optimizing diet, the conversation about food as medicine, and I listen to this and I teach it every day, and I need to listen to that advice myself, and I fully acknowledge that. And I will just sort of share a conversation that someone had with me once, and they said, you have children, right? And I said, yes. They said, would you be willing to die for your children? I said, absolutely. And they said, would you be willing to kill someone for the life of your child? And nobody wants to be placed in that situation, but the answer is, yes, for the life of my child, I would do that. And then they said, would you be willing to exercise and eat better for your child? And I said, yeah, when you put it that way. And that's what we're talking about when we start talking about physical activity, ways to motivate. And when we have conversations about the unique proposition of pregnancy and another life that the mom is bringing in, we can make it bigger than the patient themselves. And that is probably one of the best times we have to make a change. Postpartum risks. I showed you a slide that showed about a third of the pregnancy-related deaths can occur after the typical postpartum period. Now, conditions can develop during pregnancy. They may persist through pregnancy, and in fact, the conditions that you develop don't really care about your calendar. They don't really care about your duration of coverage. The disease is what the disease is. And when we get into that postpartum period, it's often an overlooked period. Moms are busy, families are tired, there's a lot going on, but the blood pressure changes may persist. And if someone has lost coverage or if someone has lost access to care, this can become a problem when there's a gap and the disease process is actually progressing. And that's one of our challenges. Also, social determinants of health. We mentioned access to care, barriers to care such as transportation, such as the lack of providers, structural and systemic changes, social determinants that all impact it. And of course, underlying a lot of these things that we're talking about is socioeconomic status, that being a barrier to be able to get someone to take care of you. So in that postpartum period, what we see similarly to what we showed before, while the number was around 84, it goes up to about 87 out of that 100 women came for a maternal postpartum checkup. It's still below national averages, and so below what the best practices are, so we still have an opportunity. So this is still where a gap exists. So I would say some key takeaways from what we've talked about today. When we talk about cardiovascular disease that shows up in pregnancy, yes, thank you for bringing the dental hygiene, the dental wellness piece to that, because we know that that can be associated with poor pregnancy outcomes. It can be associated with cardiovascular disease. But some of the key takeaways are that age over 40 is a risk factor, high blood pressure is a risk factor, obesity, race, ethnicity, lifestyle changes. And in those lifestyle changes, I would also say the lifestyle choices that individuals will make, smoking, substance use, mental health, all of these things are factors that can contribute. If someone begins to develop any of these warning signs, they should certainly seek care. These things are not necessarily normal. Faintness or shortness of breath, chest pain that is persisting, having severe swelling that is persisting, heart palpitations, or feeling unusually tired. Any of these can be warning signs that someone may need to seek care during pregnancy or in the postpartum period. And again, when I think about this postpartum period, I want you to think about it up to 365 days. And for your future health. If you're diagnosed with heart disease during your pregnancy, you may need to see your OB-GYN earlier or more often after childbirth so they can keep a close eye on your health. You should tell all, and I think this is probably one of the most important things, you should tell any future health professional that you had heart problems during pregnancy. And so to the providers in the room, when the conversation is, did you have a problem? Do you have any medical problems? The answer is no, and I pull the medical record and I say, oh, you had cardiomyopathy. That's a problem. So that is what we need to do to educate. And so when we say from the beginning, all of the people who can have an impact, it doesn't start with one, it starts with all. Patient family, providers, facilities, systems, and communities. So the Department of Health has had a media campaign, and hopefully you've seen some of the billboards across the state, making people aware of some of the warning signs that can occur with pregnancy. And also know that there are other groups out there that are working to improve and standardize care. And lastly, I'll just mention the Arkansas Perinatal Quality Collaborative is to make sure that hospitals and providers are aware of some of the trends that we're seeing and that we're basically pulling in the same direction to improve the health and wellness for our moms across the state. With that said, I thank you very much.
I just want to give Dr. Greenfield another round of applause for the excellent work that he and his team are doing with the MMRC. Thank you, Dr. Greenfield. So please allow me to introduce Sharonda Love. She's a distinguished leader with over 25 years of experience in public health and community advocacy. As my predecessor and the 7th Executive Director of the Arkansas Minority Health Commission, she was instrumental in expanding and implementing a number of programs. Here to share and reflect on her service with the Commission is the former Director, Ms. Sharonda Love. Please join me in welcoming her.
Well, good afternoon, and thank you, Director Eddings and commissioners, for this opportunity. I just want to say that I'm honored to be here, and I know that you all have heard from the former directors with reflections today, and you can see that I have stood on the shoulders of some giants within Arkansas and Arkansas's history. And so when I had the opportunity and was appointed by Governor Hutchinson to serve as the Executive Director of the Minority Health Commission, I knew I had to step up my game because I wanted to make sure that I left a true legacy that we would be able to look back and say that was really impactful for the state. And so I had the idea to purchase the first state-owned mobile health unit to drive into communities and provide access to preventive health screenings. But what I will say is when I initially came up with that thought and I talked with Governor Hutchinson, he was on board, but we had naysayers that said it's been tried and it hasn't worked in the state. And so he initially said yes, and then he came back and said, we're not going to do it because we were told that it's not going to work. And so that meant having some tough conversations in open spaces and behind closed doors to make sure that folks understood that while it may not have worked for them, that didn't mean that the trust that the Minority Health Commission had built for decades wouldn't be able to to have true impact into the community. And so I'm happy to say that we were able to push forward and purchase that mobile health unit that is still going into communities and providing access to preventive services to the people where they are. And I also want to say that when the pandemic happened, we were there to provide access to PPE, testing, and vaccinations that saved lives, lives that are still being impacted to this day. And so I just want to thank the commission for all of the work that they are doing and have done to make a true impact within our state. The Minority Health Commission is small but mighty. And as you can see, continuing to do some magnificent things to make sure that our Kansans are not only striving, but thriving. And so Director Eddings, the staff, and the commission, I appreciate you for all that you do and continue to do within the state, and thank you.
Let's please give Director Love another round of applause. That mobile health unit is truly transforming lives. We are all over the place all the time in the unit, and I know that the communities that we serve are thankful that we have it. You know, our final award today is the Jocelyn Elders Minority Health Pioneer Award. The Arkansas Minority Health Commission's Dr. Jocelyn Elders Minority Health Pioneer Award was established in honor of the AMHC founding director, former director of the Arkansas Department of Health, and the 15th Surgeon General of the United States. The commission selects the recipient or group for their innovative work for Arkansas minority populations. Dr. Elders is a professor emerita of Pediatrics, Division of Endocrinology at UAMS and Arkansas Children's Hospital. She's also a distinguished professor of the UAMS Faye W. Bozeman College of Public Health. There's also a chair in her name in sexuality education in medical schools at the University of Minnesota. Based on her studies of growth in children and the treatment of hormone-related illnesses, she has written many articles for medical research publications. She was appointed director of the Arkansas Department of Health in October 1987. While serving as director, she was elected president of the Association of State and Territorial Health Officers. Dr. Elders was nominated as Surgeon General of the United States Public Health Service by President Clinton in 1993 and served in this post until January 1995. She subsequently returned to teaching until her retirement on June 30th, 1998. Dr. Elders is a strong advocate for children's health, quality patient care, and health safety. This year's Dr. Jocelyn Elders Minority Health Pioneer Award recipient is Dr. Joe Hargrove. Dr. Hargrove, yes, clap it up for him. Dr. Hargrove is no stranger to the state of Arkansas or the nation. A native of the great metropolis of Grady, Arkansas, Dr. Hargrove is the first African-American cardiologist to practice in Arkansas and is in private practice in Little Rock with CHI St. Vincent Heart Clinic Cardiology and Medicine Clinic. Prior to entering private practice, Dr. Hargrove served as an assistant professor and director of the cardiac catheterization lab at UAMS, where he was the first African-American trained in cardiovascular diseases. Dr. Hargrove received his undergraduate degree from A.M.N. College, now the University of Arkansas at Pine Bluff. He has a graduate degree from Tuskegee Institute, which is my alma mater, and did graduate studies at Harvard University, Cornell University, and the University of Akron. He served on the science department faculty at A.M.N. College from 1967 to 1971. Dr. Hargrove received his medical degree from Case Western Reserve University School of Medicine and graduated with honors. He completed his internal medicine residency at Metropolitan General Hospital in Cleveland, Ohio, and at UAMS. He completed fellowship training in cardiology at UAMS. He's a member of several national and local professional societies, including the American Medical Association, the National Medical Association, the American Heart Association, Arkansas Medical, Dental, and Pharmaceutical Association, and is the past chairman of the board of the Association of Black Cardiologists. Additionally, Dr. Hargrove has extensive civic involvement and has served on many boards and civic organizations, including the Board of Trustees at the University of Arkansas, the Governor's Task Force on Healthcare Reform, a member of the founding board of directors for Chenal Country Club, and the Arkansas Heart Hospital Foundation Board, Sigma Pi Phi fraternity, and is a life member of both NAACP and Kappa Alpha Psi Fraternity Incorporated. He is the chairman of the Senior Leadership Council to recruit minority physicians and medical professionals to meet the needs of our diverse communities. Dr. Hargrove has received multiple honors and awards, including having been inducted into the UAPB AMNN Hall of Fame, a recipient of the NAACP Black Corporate Executive Award, and the National Medical Fellowship Lifetime Achievement Award. Dr. Hargrove has served on the Dean's Advisory Committee at UAMS, and he serves as a mentor to high school, college, and postgraduate students. He has established numerous scholarship awards and a fellowship. He lectures locally on the national level in the fields of cardiovascular disease. Now, before I ask Dr. Hargrove to come to the stage and take his award, I want to share a snippet. He doesn't know I'm about to read this. I'm going to share a snippet of a text message that I received from a family friend who had some heart issues several months ago and was seen by Dr. Hargrove. She says, I met with Dr. Hargrove yesterday, and I am so ever grateful. I tried to schedule with him when I moved back to Arkansas in 2020, but couldn't get an appointment, or maybe he wasn't taking new patients at the time. However, I am so happy with my new cardiologist. I trust him. His staff was also great. I appreciate you for not hesitating to help me. Thank you so much. I feel so much better already. I am confident that my Dr. Hargrove sees me. And isn't that what we really want as patients for our healthcare providers, is to be seen and to be heard? Dr. Hargrove has done that for 40 plus years. And so with that, Dr. Hargrove, come to the stage and accept your award.
Good afternoon.
Good afternoon.
Ms. Eddings?
Yes, sir.
Thank you much. You know, Ms. Eddings sent me a text message, a voicemail, and I was out of town, and I didn't see it, so she called me and said, Dr. Hargrove, we would like to nominate you for an award. And I said, Ms. Eddings, I think for the last month, I've gotten about 4 awards. And when you get my age, you're wondering if they're trying to tell you something. But after she told me this was for my good friend, Dr. Jocelyn Elders, I told her I enthusiastically accepted. I just want to say I'm extremely proud and honored to be selected this year for the Jocelyn Elders Pioneers in Medicine Award. There could be nothing any greater. Dr. Elders I've known Since coming back to Arkansas after medical school, she was on the faculty and I was a resident, and eventually we became faculty members together. She was always gracious, always pleasant, and always informative. The Minority Health Commission would not be in existence without Dr. Ellis. I remember those days when Dr. Townsend and Llewellyn and the Arkansas legislature met with Dr. Ellis, and she gave a good presentation, which led to the formation of the Minority Health Commission and the employment of my good friend, Mr. Thomas Sproles. I always tell Mr. Sproles, he and Dr. Springer was far ahead of their time because they were doing ambulatory medicine when it was not popular. And they were trailblazers. And he became a trailblazer with the Minority Health Commission. And I'm so proud to have been affiliated with the Minority Health Commission and have served and worked with many of its leaders, and especially with the current leader. It's been 37 years, and the Minority Health Commission has done an exemplary job. And the nice thing about it, we see some of the same poor patients, and that's what makes it unique. And I have one quote that I like to think about when I think about Dr. Ellis. She said, health is not the absence of disease, but rather it's economics, it's education, it's environment, it's empowerment, and it's community. Now, Dr. Ellis, as you know, has many, many quotes, but that's one of her favorite ones for me. You know, as the first African-American to train at the University of Arkansas and to practice as a cardiologist fellow, and then to practice cardiologist in the state of Arkansas, I've had a unique opportunity to observe the devastating impact that cardiovascular disease has imposed on all communities, but especially African-American communities. Arkansas is noted for being the worst state in the country for cardiovascular disease. Arkansas ranks #1 for heart attacks and #4 for cardiovascular-related deaths. But don't be dismayed. Guess what? 80% of heart disease is preventable. Now, as Dr. Fletcher stated quite eloquently earlier, we can't do anything. We cannot select our parents. That was done for us. We cannot select our gender. That was done for us. We cannot select our age. But guess what? We can select our diet, and we can control our risk factors. So I recommend that everybody has a phone, and most people love to Google heart healthy diet, so you can know the types of foods you should eat. Read about the DASH diet, DASH, and the Mediterranean diet. Those will put you on the road to a healthy lifestyle. Also, control your risk factors. Arkansas is worse in cardiovascular disease because we're also worse in hypertension, diabetes, and obesity. So if we can control those risk factors, and we can, and not smoke, the 80% is achievable. Now, I can't make you live forever, but with God's help, I can help you die healthy. Thank you.
Yes, we all want to die healthy, Dr. Hargrove. Thank you. I'm going to have to use that. Yes. So we have come. Have you had a good day? I know I have. Yes. The Arkansas Minority Health Commission has a board of commissioners who provide guidance and counsel. Our board chair is Dr. Letitia Gaither Davis from the great city of Marion, Arkansas. Dr. Gaither Davis, would you please come and share remarks at this time? Please give her a round of applause as she comes.
Good afternoon, everybody. Good afternoon. I'm Dr. Letitia Gaither Davis, the chair of the Arkansas Minority Health Commission, and I'm truly honored and blessed to be a part of this work, and most importantly, to be a part of this community. As we close, I keep thinking about the Bridge Builder poem that our former executive director, Mr. Sprouls, mentioned during his opening remarks. For 35 years, this commission has been doing that work, building bridges. Bridges to care, bridges to access, and bridges to better health for communities across the entire state of Arkansas. Today, we focused on something that impacts so many of our families, which is heart health. But it doesn't just stop here. We don't just talk about the bridge. We keep building it because someone is still waiting on that other side. So I want to thank you all because each of us, we're part of that. And I know that you all will continue to do your part and help build that bridge. Thank you.
The Secretary of Health, Renee Mallory, was unable to join us this afternoon. And so in her stead, we have Dr. Jennifer Dillahay, who's the director of the Arkansas Department of Health. Dr. Dillahay, would you please come forward and provide remarks? Please give her a round of applause as she comes.
I would really like to thank the Arkansas Minority Health Commission for this conference. I think they, the health department, and probably everyone in this room share a common goal, and that is we want all Arkansans to have an opportunity to live a healthy, vibrant, fulfilling life. Heart disease is one of the greatest barriers that is most likely to keep us from doing that. But as I see it, you're here because you care about this. So we, in this room, I think, have the power to be leaders and make a difference, and I think there's two ways we're going to do it. One is that we can use our spheres of influence to make changes. Where we work, where we live in our communities, and most importantly, in our families. And the best way we're going to do that is to be the change that we want to see. And that's going to take courage and compassion. Compassion not just for other people, but for ourselves. It's kind of like what Dr. Greenfield was saying, would you be willing to die for someone else? Would you be willing to make the change for yourself? That's what's going to give us the steadfast resolve that we need to make a change in this state. Because if we don't make a change, no one else is going to do it for us, right? Mm-hmm. So I just am glad we're here. I'm glad we have this clarity. And so let me just say thank you for being here, and go forth and do good.
Thank you, Dr. Dillahay. So I just want to give a special thank you to everyone who came out to celebrate our 9th Biennial Minority Health Summit, as well as our 35th anniversary. We appreciate all of our speakers, all of our panelists, and I want to give a special shout out to Dr. Anthony Fletcher. Yes, clap it up for him, for sure. Because of his partnership, because of his thought leadership, because of his ingenuity, we are able to do things now at the Commission. We are able to expand our services because of our partnership with Dr. Fletcher. And so thank you, Dr. Fletcher. You know, Dr. Murphy said something earlier, and I wrote it down. He said, to get out there, You need to go out there. That's what the Arkansas Minority Health Commission does every day for the last 35 years. I tell everyone all the time, we are all over the place all the time. And you guys see us out there. Thank you for your continued support for the work that we do. There's a quote that says, "Many hands make light work." So the hands of all of these presenters, plus yours, both in person and via live stream, can and do make a difference. Let's keep working together to improve the health of all minority Arkansans and to improve the health of all Arkansans. Thank you so much to our stage sponsors, Ethan Allen. They provided this beautiful furniture that you see here. We want to also say thank you so much to the Association of Black Cardiologists for sponsoring today's lunch. Remember, there's an evaluation. In your program booklet, there's a QR code or a website. Please take it. It's on the screen. Please take it. We know we do good work, but we just want to hear from you. What do you think about the work that we do? We can't do better if we don't know better, so we want to hear from you. Don't forget that we have our inaugural Family Fun Day tomorrow from 11 a.m. to 3 p.m. at the West Central Community Center. We're going to have fun in the name of health. If you remember a time when you were in school and you were good all year, you got a chance to go outside and have a field day, well, that's what we're going to do tomorrow. We're going to run, we're going to play, we're going to do some 3-leg races, some potato sack races, we're going to do some cornhole, and everything in between in the name of heart health. Because think about it, when we were kids running and playing, we didn't know that we were exercising our heart, getting that exercise. So that's what we're going to do tomorrow. Come out, have fun with us, get your health screenings. And then also enjoy some free food and some free fun. So 11 to 3 tomorrow at the West Central Community Center. Thank you all so much again for being here, and thank you for your continued support. Everybody have a great weekend. Thank you.